If you are new to the channel, be sure to subscribe to get similar content every week.
Over the past few days, we have been in consultation with various stakeholders. We've met with business, labor, and community constituency in NEDLAC. We've met with our premiers, MECs, and metro mayors, and with the members of the Presidential Economic Advisory Council. Following these meetings, Cabinet considered various proposals and finalized social relief and economic support package that stands at the center of the second phase of our economic response. This involves, firstly, an extraordinary health budget to respond to the coronavirus pandemic. Secondly, the relief of hunger and social distress. Thirdly, support for companies and workers. And fourthly, the phased reopening of the economy. The impact of the coronavirus requires an extraordinary coronavirus budget of around 500 billion rand to direct resources towards fighting the pandemic. This will include the reprioritization of around 130 billion rand within our current budget. The rest of the funds will be raised from both local sources, such as the Unemployment Insurance Fund, and from global partners and international finance institutions. To date, the World Bank, the International Monetary Fund, the BRICS Bank, the New Development Bank that is, and the African Development Bank have been approached and are working with the National Treasury on various funding transactions. Some of these institutions have created financing packages that are aimed at assisting countries that are having to address the coronavirus crisis like us. This funding will be used in the first instance to fund the health response to coronavirus. An amount of 20 billion will be directed towards addressing our efforts to this pandemic. If we are to successfully manage the anticipated surge in cases and ensure that everyone who needs treatment receives it, we must provide for additional expenditure on personal protective equipment for health workers, community screening, an increase in testing capacity, additional beds in field hospitals, ventilators, medicine, and staffing.